In 2023, 123 infants died in Cuyahoga County, a rate 41% higher than the national average. Many of these deaths were preventable and linked to unsafe housing, limited healthcare access, and lack of support for parents. Infant mortality is more than just a statistic. It reflects gaps in how well a community protects its most vulnerable members. As a community, we have a responsibility to care for everyone, especially infants who cannot care for themselves. We must recognize the systematic injustices that contribute to infant mortality, including underfunded healthcare, unpaid parental leave, poverty, and limited caregiver education. Some families face disadvantage before a child is even born, and when mothers lack quality care, infants suffer the consequences. But there is still hope. Through justice, education, and community action, we can reduce infant mortality. Programs like Babies Need to Breathe teach families safe sleep practices, but real change requires communities, government leaders, churches, and healthcare workers working together. From a Catholic social teachings perspective, every human life has dignity and a right to life. We have a moral obligation to protect those without a voice, especially infants. Our essential question is how we can help and preserve the lives of infants as well as spread awareness of this alarming problem. Our mission is to deepen our understanding of infant mortality so that we can serve others through raising awareness, acts of service, and inspiring action. Ultimately, we ask, how can we respond with compassion and action to help address the infant mortality crisis?
When people hear the term infant mortality, many assume it's a problem of the past or something that only happens in poor or distant countries. But the truth is, infant mortality is still happening today, and at alarming rates. Infant mortality is defined as the death of a baby before their first birthday, and every year, millions of families experience this loss, often from causes that could have been prevented. According to the World Health Organization, 2.3 million newborns died within the first 28 days of life in 2022. This is about 6,500 babies every single day. The WHO reports that most of these deaths are caused by premature birth, complications during delivery, and lack of medical care, things that could have been prevented with early prenatal care, trained medical staff, and proper nutrition. Where a baby is born plays a major role in whether they survive. The WHO states that newborn death rates in sub-Saharan Africa are nearly 9 times higher than in wealthier regions like Europe, showing how deeply poverty and access to healthcare affect survival. This issue is not just global, it is happening right here in the United States. According to the Centers for Disease Control and Prevention, the U.S. infant mortality rate is higher than that of many other developed nations. Even more concerning is the racial gap. The CDC reports that Black infants die at more than twice the rate of white infants, and this gap remains even when income and education levels are similar. This shows that infant mortality is not just about individual choice, but about systemic racism, stress, and unequal access to healthcare. In Ohio, the data tells an equally similar story. According to the Ohio Annual Infant Mortality Report, 904 infants died in Ohio in 2023, and the infant mortality rate remained at 7.1 deaths per 1,000 births. Black infants in Ohio die at a rate of 13.7 deaths per 1,000 births, more than double the rate for white infants. The report also shows that 30% of infant deaths are linked to prematurity. Over half of these infants were born to mothers on Medicaid, and 42% of mothers did not receive prenatal care in the first trimester. These facts make one thing clear. Infant mortality is not random. According to the World Health Organization, the CDC, and the Ohio State Health data, preventable infant deaths are closely tied to inequality. Awareness matters because when we understand the data, we begin to see infant mortality not just as a statistic, but as a reflection of how well or how poorly society protects its most vulnerable members.
For our action, our group wanted to do something about infant mortality, and we figured it was not just about medical stuff like hospitals. We came up with 3 ideas: Charles Martin Corvey Fund, birthing beautiful communities, and donating diapers to the Cleveland Diaper Bank. All 3 were great options, but ultimately we decided to go with the Cleveland Diaper Bank. Often it comes down to basic things families need to get by. Financial problems hit hard, and parents struggle to afford even simple items for their babies. Diapers are one of those things we do not think about much, but without them, babies risk infections or worse health issues. A lot of families struggle to afford diapers because of bigger things. This is where the idea of justice versus charity really shows up. Charity is when we help someone in the moment, like giving diapers to families who need them right now. Justice, however, is about fixing systemic issues like low wages, high costs, or lack of support. That's a justice issue. But while those bigger problems take a long time to solve, charity can still make an immediate impact. We decided to collect money specifically for buying diapers to help out. Everyone in the group pitched in by raising funds however they could, and it added up pretty quickly. Then we all separately with the money to purchase as many as we could and donate them to families in need. We all met up to see how many diapers we had collected before driving to the Cleveland Diaper Bank. Once we got to the diaper bank, everything went pretty smoothly and we were able to drop off. It feels like donating diapers is not a big deal at first, but it really helps keep babies clean and avoid complications that could lead to bigger problems. This showed us that supporting infant health can be shown in many ways and doesn't need to be some huge action. Even just donating diapers can go a long way. When people in a community pull together, even little actions can make a difference. Giving access to basics like diapers lets babies stay healthy and gives a parent a break from worry. Every bit helps, and it is a reminder that we can all contribute to better lives somehow. Sort of makes you think about what else goes overlooked.
Infant mortality, or the death of a baby before their first birthday, is a serious issue, and it shows us the unfair treatment that some communities face. In the US, babies in low-income or minority communities are much more likely to die before they turn 1. This isn't just bad luck, it's caused by bigger problems like poor maternal health, not enough access to good health care, and unsafe living conditions. According to the National Institute of Health, babies born to mothers who don't get enough prenatal care are more likely to have serious health problems or even die. On top of that, Black and Hispanic mothers often face discrimination and are not taken as seriously in the healthcare system. This leads to deaths that could have been prevented. As Catholics, we're called to do something about this. In Matthew chapter 25, verse 40, Jesus tells us, "Whatever you did for one of the least of these brothers and sisters of mine, you did for me." This means when we see people suffering, especially vulnerable children, we're called to take action. Catholic social teaching also talks about solidarity, which means we're all connected and we must stand with the most vulnerable. We can't just ignore this injustice. It's not only about individual responsibility, but also about changing the systems that let this happen. One charism of the Church is compassion. This calls us to walk with those who are suffering, to listen to them and care for them with kindness. This is key when we're addressing issues like infant mortality because we need to do more than just recognize the problem, we need to help fix it. Another important charism is justice, which pushes us to fight for fairness. It's about changing the systems that allow inequality, especially those that hurt vulnerable communities. Catholic social teaching also provides us with important documents. Gaudium et Spes from the Second Vatican Council teaches us to respect the dignity of every human person and to take action against poverty and inequality, issues directly related to infant mortality. In Evangelii Gaudium, Pope Francis emphasizes the need for solidarity and to challenge social injustice. He calls us to move beyond charity and create a world where everyone, especially the poor and vulnerable, has a fair chance. Through the cycle of Praxis, we reflect on the injustices, take steps to change it, and work together to build a fairer world. Every child, no matter their background, deserves the chance to live and thrive.
Infant mortality shows deep inequality in the United States, and state and national laws strongly affect outcomes. In an interview on December 23rd at the Cleveland Medical Examiner's Office, Dr. Allison Kay explained that many infant deaths are preventable and are shaped by living conditions, access to care, and financial stability. On December 1st, 2025, at Barnes & Noble in Eaton, Stacy Hren from First Year Cleveland also emphasized that reducing infant mortality requires policy and system change, not just medical treatment. At the national level, programs like Medicaid and CHIP help cover prenatal and postnatal care, and the Affordable Care Act expanded maternity coverage as well. However, gaps remain. Many women lose Medicaid coverage soon after giving birth, which can interrupt important care. Hren explained that policy decisions at both the state and federal levels greatly impact health before and after birth. Ohio has taken many steps to improve outcomes. The Ohio Infant Mortality Reduction Initiative focuses on better prenatal care, reducing preterm births, and safe sleep education. The state also expanded Medicaid postpartum coverage from 60 days to 12 months, While this helps, access to care is still uneven, especially in low-income and rural areas. Friend also noted that Cleveland continues to have one of the highest infant mortality rates among major cities, partially due to historic racism and segregation that created unequal neighborhood communities and conditions. A major reason infant mortality remains high is the inconsistent health care before and after birth. Babies whose mothers receive little or no prenatal care face much higher risk. Prenatal visits lower the chances of premature birth and low birth weight, and regular checkups help catch problems early. Ohio also lacks strong family support policies like paid leave and subsidized health care, which adds stress and financial strain to families. Cost is another major barrier. Families may struggle with transportation, unpaid time off work, and medication costs. There are also shortages of providers who accept Medicaid. When families must choose between income and medical care, infants face greater risk. Racial and geographic disparities make the problem worse. Black infants in Ohio and across the country die at more than twice the rate of white infants. This shows that long-lasting structural inequality, segregation, and unequal treatment in healthcare systems still affect outcomes today. Overall, infant mortality is not just a medical issue, it reflects a broader social and economic inequality. While state and national programs have helped, stronger policies, better access to care and paid leave, affordable health care, and community investment are needed to prevent avoidable infant deaths. Many people think infant mortality only happens in poor countries, but it is still a serious issue in the United States. Infant mortality means a baby dies before the first birthday, and many of these deaths are preventable. Our mission is to reduce these deaths by improving access to healthcare, education, and support for mothers and infants. Our essential question is, how can improving access to healthcare, education, and support for mothers and infants help reduce infant mortality rates? Worldwide, millions of babies die each year, often from early birth, delivery problems, or lack of medical care. Prenatal visits, safe deliveries, and parental education on safe sleep and nutrition can lower these risks. Support during and after pregnancy also improves outcomes, which directly answers our essential question. In the United States, infant mortality is higher than in most other developed countries. Black infants die at more than twice the rate of white infants, showing that unequal access to care plays a major role. In Ohio, hundreds of infants die each year, often linked to early birth and limited prenatal care. Expanding affordable care and stronger support systems would help reduce these numbers. Infant mortality is not just a medical issue, it reflects how well families are supported. When mothers have quality health care, clear education, and strong support, babies are more likely to survive and thrive.